Specialized pharmaceutical care at home involves the relocation of specialized medication treatments from the hospital to the patient's own environment. For patients with hypogammaglobulinemia who would otherwise need to frequently visit the hospital for infusions. This is always coordinated with their healthcare provider. This approach ensures that healthcare is organized as closely as possible to the patient's own home, making it more convenient and accessible for the patient.
In 2016, we initiated the organization of home management of antibiotics, and a year later we began to manage immunoglobulins at home. We established a strong foundation by working with the treatment team to adopt an integrated approach to healthcare outside of the hospital. Almost 1,500 patients each year benefit from the option of specialized medication administration at home.
So have you thought about which treatment route you prefer?
To have all the control for myself, I would prefer.
When a patient is informed that immunoglobulin treatment is necessary, the patient is provided with information about the various methods of administration. The healthcare provider also discusses the specific advantages and disadvantages of each method. It is explained that, in general, treatment takes place at home after the initial treatment in the daycare facility. Of course, only if it's feasible. Through shared decision-making, the healthcare provider and patient come to a joint treatment choice. At the UMC Utrecht, further coordination of the integrated treatment is facilitated by the Transfer Bureau.
An integrated approach means that we bring together all of a patient's healthcare needs and then, in consultation with the patient, organize the care to be personalized, taking into account what the patient wants and is able to do. Various parties play a significant role in organizing this care. First of all, the treatment team, with the healthcare provider who is discussing these matters with the patient. The daycare facility, where the first two treatments take place and where any instruction for self-management are provided by the nurse. Transfer nurses, responsible for arranging suitable home care. The pharmacy, responsible for preparing the medication and the distribution. Last but not least, the home care nurses, who manage the immunoglobulin if needed and provide additional specific healthcare services. They also further support patients in self-management. If specific knowledge is required to the home care nurses, the transfer nurses and the treatment team offer training at the UMC Utrecht.
Healthcare providers can better align with the preferences of patients. Administering immunoglobulins at home contributes to the quality of life for patients. They can work from home more often or perform other household tasks that were previously not possible. Additionally, they have more flexibility in the timing of treatment when self-administering. This shift of care to the home environment also creates space in hospital for patients who generally require hospital-based treatment.
There are increasingly more opportunities to remotely monitor the effects of treatment on the patient at home and provide feedback to the treatment team. This involves a combination of digital tools, such as monitoring through an app and equipment for measuring various parameters, which is a valuable and highly desirable addition. Furthermore, the capability for laboratory diagnostics in the patient's own home is a valuable supplement to the integrated treatment.
The options were discussed in the beginning by my doctor, and also she said that a lot of patients are doing the home administration. It was really good to be involved in shared decision making with the doctor to see what are the options so I could choose what fits for me. At the beginning I had no experience also with everything, so I learned a lot from home care and other nurses. I'm more flexible to do it in my own and doing by myself.